Welcome to another episode of the Back to School Shootings podcast. My name is David Reedman. I'm the creator of the K through 12 school shooting database. And like many of the prior podcasts, this is going to be an episode about another academic paper that appeared in my Google alerts. And this one was published by the American Academy of Pediatrics. It's in Pediatrics, which is the flagship publication and one of the top index journals for publishing research findings, and it's called Trends in Carrying Handguns Among Florida Adolescents, and it's a study from 2002 to 2022. And to discuss the findings in this paper, I'm joined today by Dr. Erin Wright-Kelly, who is the Director of Research and Evaluation of the Firearm Injury Prevention Initiative at the Colorado School of Public Health. Dr. Wright-Kelly, thank you so much for coming on the show today.
Thank you for having me and for the work you do in this area.
So before we get into your paper, you've got a very interesting position where you're a research associate at the Injury and Violence Prevention Center. You're also a research director at a Firearm Injury Prevention Initiative. This is all something that sits within the University of Colorado School of Public Health. How did you end up in this kind of academic research center focused on firearms, and why is it at the University of Colorado?
Yeah, accidentally, but in the best kind of way possible. So I like to define my career trajectory as really being from community and listening to community. I grew up in a small town in Iowa. And I think that has always shaped a lot of my experience of kind of community and connection and the importance of people having each other's backs and being supportive in that way. And I actually started by studying anthropology, wanted to understand what other communities around the world were like. Um, Ended up in international development work actually for a little bit of time, and then started thinking more about what I could do in my own backyard to really help address some of different societal issues. And that's how I got pulled into public health broadly. I worked in local public health and ended up doing a lot of kind of data and assessment during that time. And I think I really liked this blend of being able to use data to understand people's voices, because I think that's fundamentally what data are. Actual voices from people telling us what they have experienced and what they think we should do about different pieces have done really well. And that's both quantitative data and qualitative information people provide. And so love this blend of being able to work directly with community and using data to inform some of that work. And so I ended up going back to get my Doctor of Public Health degree because I was really interested in this blend, which is how I ended up getting pulled back into the academic side. But I think the reason I still am in academia and rather than departing after I finished my degree is because actually the University of Colorado hosts these two institutions that fundamentally believe in the importance of engaging community, whether that's in data collection or interpreting results and what this means and how we put into action. So I found a center or a couple of centers where I think really focus on that engagement, ongoing engagement with community. So it's been a really good, happy spot for me to grow my career. For firearm injury prevention specifically, I was really interested in community violence prevention and suicide prevention for the last kind of 10 years of my career, just given the enormous impact those have on different communities. And firearms, as I started to learn more, are such a proximal risk factor in both of those kind of circumstances. And something where I felt like, while I'm really interested in those ongoing conversations around social determinants, as we call them, how people access education or have a job and all those different supports that can be put in place. Firearms were this really interesting kind of common theme that kept popping up, even in the data around being such a risk factor for injury and death in these spaces. And so I started wondering about how we could be addressing that proximal lethal means access as part of preventing injury and death in these cases while still working on these broader societal issues. So ended up in the firearms space as part of that kind of ongoing combination of combining research and community.
And then just for the audience to explain, because it can be complicated when you hear public health versus medicine versus doctor, What's the big difference between a doctor of public health versus a medical doctor, many of whom have master's degrees in public health as well?
Yeah, so I do not have any clinical background or experience. That's the primary difference. In my degree, I think about my um, uh, patients as being an entire population. So I think about broad communities and the impact things can have on them. And so education or higher level prevention strategies or programs that can be put in place. I do less direct work with people individually, which a lot of clinicians do. But per what you said, a lot of clinicians are appropriately expanding into population-based work as well and have MPH degrees too.
Oh, that's very helpful. And then it's we've had a lot of guests on the show where people have backgrounds in sociology or criminology or criminal justice. Anthropology kind of sits within the same branches of those social science trees, but it looks at things kind of from a fundamentally different perspective than the way that society impacts a person or the way that a person is deviant or not or interacts with social institutions. How do you think that not early education, I mean, you have a master's in anthropology. How does anthropology impact the way that you think about public health?
I think in every way. I think what I just said of how I think about populations as a community is a big piece of what shapes it. Every time I think about even the way an individual makes a decision, I don't see it as an individual made a decision in that moment in time. I see it as what brought them to that space, what community shaped them, how did they interact with different communities along the way. So I think of an individual in an entire system, which I think anthropology is fundamentally about systems level work.
Well, that's a good transition into your paper, which is the trends of carrying handguns among Florida adolescents over a 20-year period. And you have this huge cross-sectional representative survey of middle and high school students in Florida, more than 700,000 responses on the survey. But I think the first question that stands out is, why is a researcher in Colorado looking at this firearms data from Florida? Why aren't you looking at either students in Colorado or all of the students in the whole country?
Great question. So, multi-layered response to that. But first and foremost is exactly, thank you for setting me up perfectly for that, but exactly what I was just talking about. While I think national trends are very important in looking at different things, I fundamentally believe that people act differently in different contexts. And so when we can have less national, so more minute geographic data, like in different states, as an example, I think it's really compelling and interesting to look at those because they can often tell a very different story than those national trends. Because remember, a national trend is this thing that comes together that puts everyone together in one big bin. So being able to pick apart those different levels of data are it's really interesting from a research perspective. The other piece for me then too is that when I first found out about this data set, and it's actually one of the colleagues that's a co-author on the paper, was at a conference in which she talked to someone from Florida pretty randomly. And they said, hey, we have all of these gun carrying questions. I got an email just because of my interest in firearm injury prevention work, specifically among youth populations. Um, and I actually had the response of, oh my gosh, I don't know any other states that have these data, or frankly, there's not really a national marker in the way that Florida has it. So I would say, as far as I'm aware, Florida has one of the most robust data sets around youth gun carrying, generally in schools, and then some of these kind of preemptive sociocultural norms pieces that you can look at as well that I have seen in the nation so far.
Why do you think that Florida has this data set, but it's not? Why doesn't every, major city or suburban area or state have a similar data set?
Yeah, so in the field of injury prevention specifically, and I want to be a little cautious here because some of this is around politics, right? So uh, it's well known in our field that we have pretty limited access to data sets broadly. And I would say in the injury and violence prevention space, some of those have often been limited even more broadly than just firearm specific. Some of that is politics that occurred about 25 years ago, the Dickey Amendment.
Connecting this all, the Dickey Amendment came as a response to the 1989 Stockton school shooting, and that was the first major school shooting that drove state level legislation with the first quote unquote assault weapons ban at the state level in California. That led to the passage of the Safe Schools Act and the Gun Free School Zone legislation in 1994. So two different federal pieces of legislation. Those all came out of one school shooting in 1989. But then, as you say, with the Dickey Amendment, there was then a significant pushback from congressional Republicans to say, if you're going to pass state and federal firearms regulation, we are going to cut the bottom out of all firearms injury related research. Anything else on that?
Yeah, I am so grateful that you knew the connections of these pieces. I actually wasn't aware of that. So I will say from a data and research perspective, exactly what you just outlined, the kind of fallout of that, so not related to assault rifles at all, is that it became very difficult for researchers and even practitioners to be able to collect any data, much less develop out any robust data sources. And so in about 2020, 2021, they actually lessened some of that, and the NIH and the CDC started funding more firearm injury prevention research. But if you think of that, essentially what happened is that we had about a 25-year gap in how much data we were collecting that specifically called out firearm involvement, all those different pieces. So researchers and practitioners are really trying to catch up. And I think there's a whole movement around building better data infrastructure. There's multiple reports from the University of Chicago out about that piece. But what happened is you have disconnected systems, a pretty weak federal system for overall collecting information about the broad impacts firearms can have. Both, I would say, from a protective and or harms perspective, right? And what in states that had systems in place, either they were developing them on their own or they had already had them in place, right? So, but it became down to state level or even local level decision making around when to collect those pieces. So everything is pretty fragmented, right? Of these pieces aren't connected together. States often weren't talking to each other about these. But Florida came out in the midst of that as having an ongoing variables or measures in those surveys. The questions they actually never changed from 2002 on. So I can't say as to why Florida decided to ask these questions, but it became a part of their survey and they never removed those in that 20-year period.
Yeah, and Florida is a unique place in the context of public education because Florida kind of is a microcosm of the entire United States, where you have 4 major metro areas, you have a lot of rural spaces in between, very large population. I think it's the third or fourth highest population in the country, 4 of the 10 largest school districts in the country. So there's actually a lot that goes on behind the scenes in terms of new curriculum piloting, new AP classes, textbook adoption. There's a lot of kind of mechanics of what happens and is tested and then moves forward in the Florida school districts, ends up kind of setting education policy that gets used and adopted by other jurisdictions all over the country. So it would make sense that Florida, with really ample resources for education, would then do some deeper data collection. So that may be one of the reasons that something like this happens in Florida. It doesn't happen in other places.
Yeah, I will also say, and I don't know the history, but these measures did come out of the Communities That Care youth survey that was developed actually in Washington. So in several states took on that survey at one point. So they might have also been doing some larger work around the communities that care prevention system too, that might have linked up as well.
So you found out about this big data set. You found out you had 20 years worth of data. How did you scope your research questions for it? And then once you figured out those research questions, what kinds of things did you have to do with this data to then start answering your questions?
Yeah. So I will say I was interested in looking at the trends over time just because there were such robust data across all of those years. But then the other piece for me in the work that I do, just like I said, that with national data, sometimes you aren't able to see those differences in lower level regions like states or even beyond that. It's the same for just looking at trends overall. So I was particularly interested in looking at what had changed since from 2002 to 2022 in different sociodemographic and geographic groups as well. So we were able to look at the trends in terms of just doing, and we did that by looking at weighted prevalence, and we just did regression models, a pretty standard procedure for looking at those, used interaction terms to make sure that each of those potential groups was unique in the model. But then we also added in a secondary analysis, which was looking at the odds ratio, which compared the prevalence in 2002 to in the same subgroup, so males or females, for example, and then compared it to 2022 so that we could get a sense of which groups were actually accounting for more or less of those changes during that time. And I think that's such an important way to look at the question because to me, it goes back to this community engagement piece. How do we then target specific populations that might be changing over time to better understand one, why they might be changing those behaviors, and then two, develop appropriate resources to be able to work with them to make sure we're preventing any potential harms.
So you found a couple different subgroups in the data to look at. You separated by by gender, by rural versus urban, by school level. What did you find once you looked at the data and saw the differences between 2002 and 2022? And thinking about where we were in 2002, that's 3 years after Columbine. It's a year after the 9/11 attacks. The I don't think there was a lot of focus on school safety right then because there were so many other things going on. Sandy Hook happens in the middle, and then 2018, there's the Parkland shooting in Florida that puts a huge emphasis on state legislation, increasing school policing, increasing school security. So there's a lot of kind of social and legal factors that happened over that 20-year period.
Yeah. So overall, in terms of young people in Florida carrying handguns to school, we found a 60% decrease during that time of their self-reports of carrying to school. And to give a sense of what that means, it was at only 1.1%, which seems like it's a bit rare. That's one in 100 kids that they had carried a handgun to school in 2002, right after you had just described all those historical kind of pieces of what was occurring. Um, but I think of that in my tiny town, right? Of I had 400 people in my high school, so that means there were two people in that year that had carried a handgun to my school. Um, by the time we reached 2022, that decreased 60%. So about one in 200 kids was saying, or sorry, that would be four in my 400 at that time. But by the time we reached 2022, that would have dropped to about one in 200, or in my school growing up, two in 400 that had carried a handgun. So I would say there was a pretty dramatic drop in young people who had said that they were carrying a handgun to school. Noting that an interesting piece in that overall trend is that um, we actually saw a 65% increase in young people saying that they were carrying handguns generally, which you can generally interpret to be outside of school, but where is not asked in the survey, so I can't speak to that point. But so that could mean that the young people are still carrying as much, if not more, but they've shifted to it just not being within their school. So that's an interesting data point in that overall trend, just right up front.
So looking at the numbers in this, so it was a survey of just over 700,000 students, and in 2002, roughly 7,000 of those 700,000 students said they carried a gun to school. By 2022, that had dropped to 2,500 out of 700,000 students carrying a gun to school. Um, I mean, it's still a pretty scary number to think that there are 2,500 kids, but at the same time, those there was an increase in carrying other places. And I think that tracks with data that I've looked at. I did a small study during a summer of shootings in public spaces. And those were malls, shopping centers, parking lots, parks, things like that. The majority of those were just like the shootings on school property. They were escalations of disputes, usually between teenagers, and somebody pulls out a gun because they're a habitual gun carrier. They had no intent of shooting somebody that day, but then that fight between teens turns into shots fired. So it sounds like it maybe, and this is all speculation, that increasing security and policing in schools impacted kids uh, carrying within the school building, but they're actually carrying their guns more often in other places.
So that is one thing in our discussion we call out of it would be very helpful for people to research really what led to that decrease, including whether it was school security, and that could be physical presence of an officer or metal detectors. But it could be on the other side of that too, which is that there's more social emotional learning programs in place or better kind of school climate support. So I think that's definitely a next step, and where I think it would be very interesting to figure out what occurred in schools to really help um, contribute to that decrease. But yes, whether or not that means that it's just shifted behavior or they've increased in different ways, that's also another question that we have from the data.
Yeah, I've always, wondered just from the behavioral economics standpoint if we've just created, an opportunity cost with schools where even if you don't face major disciplinary action, a gun on the street is $500 to $1,000, and if there's a chance that that's going to get confiscated from your locker or backpack or whatever when you're going into school, I mean, $1,000 is not is a significant amount of money for a teen of any age. I mean, that's the difference between buying a new Xbox or needing to buy another gun. So if it just once we increase security, is it just the like, oh, I don't want this really valuable, important thing to me that I carry around everywhere to be taken?
Yeah, and I think that comment absolutely emphasizes why so much more work is needed in this. And I think some of that is qualitative too, right? Of like, are they deciding that because of just the costs or different motivations? It's a really great next step.
You also found some differences in gender and school level and demographics of the students that were carrying guns. What were those?
Yeah. So while males overall, and I want to just say up front too, in terms of how I talk about these different subgroups, we are using the way that the survey asked the questions. So while I might not use those, and I do want to be accurate to how students actually said they identified on the survey. So for example, the two gender groups are only divided between sex of female and male. So I'll reference my findings in kind of that way. But so overall, while males still had the higher prevalence of still saying that they carried in school, a fascinating finding, and this actually was the same for general handgun carrying, but is that while males decreased from 1.7% they were carrying, saying they were carrying in schools in 2002, and then only to 0.5% in 2022, females also did reduce, but they only reduced by 0.2% overall. So by 2022, they were still at 0.3. So males actually accounted for the significant proportion of the decrease in carrying during that time. Females didn't as much. And we actually saw a higher increase in females saying that they were carrying handguns overall. So females have really come out as a really interesting and population in Florida to try to better understand motivations for carrying overall. In addition, we saw decreases in both middle school and high school. The more interesting finding here actually is in general handgun carrying. Middle school students accounted for the bigger increase in handgun carrying overall, but actually about both they actually saw a higher decrease in school handgun carrying compared to the high school students. So both groups saw decreases, but middle school actually accounted for more of the decrease during that 20-year range for them too. So just an interesting piece of higher increase in general handgun carrying, so outside of school for middle school youth, but contributed more substantially to the decrease for in-school carrying. So something's happening there with young people in terms of that reduction in handgun carrying in their schools. Um, and then in general, we also asked about race ethnicity. These are how they also wrote these groups in the survey too. Um, but while African American and then a group that is broadly other racial and ethnic identities, essentially, which is a way we kind of had to collapse different groups in here to make sure we have an appropriate sample size to look at them. But those saw the highest prevalence of still carrying in schools, but both also still saw, but race or for those who identified as Black or African American, there was actually they had the biggest decrease, or one of the biggest decreases in carrying in schools overall. So you're seeing a lot of movement in terms of decrease in those who identify as Black or African American, which is great from a kind of practice prevention standpoint, but still remain the highest overall. But white and Hispanic and multiracial and multi-ethnic groups accounted for the biggest decreases in carrying in school for those groups. And then finally, we also looked at urbanicity within this too. And so this is really interesting. Rural students who, just to say, and I know you described Florida's makeup, the way that they ask this question is they say, do you live in a city, town, or a suburb, or do you live in a rural area? So this is not based off of zip code or anything like this. It's just where they said that they identified living geographically. But only 13% of youth overall in Florida say that they live in a rural area. So largely a more kind of urban context here. But that 13% of the proportion of youth actually accounted for the biggest decrease in carrying in schools. Overall, it went from 1.1% to 0.4%, so 80% decrease for that group in the 20-year period, versus there was still about a 50% decrease in urban areas. But now what happened in 2022 is those are now equal reports of carrying at 0.4%. So really interesting when you break down the data to look at it this way.
And just, since I live in Florida and there are some interesting laws, there's some things that people in other parts of the country wouldn't be familiar with that really normalize firearm carrying, especially in the smaller towns or the rural areas. One of those is if you are fishing in Florida, where there's the Everglades and lots of swamps and everything, there are alligators that are always present. So someone, including a supervised minor, is allowed to carry a firearm anytime that they're fishing. And that can be walking to the pond in your neighborhood with a fishing rod. It can be in a public area with a fishing rod. But there's a very normalized, socially acceptable firearm carrying behavior that is participated in by youths. And I think that just when you talk about communities and anthropology, you have to understand also that there are some very uniquely different things about Florida that might impact some of the socially acceptable behaviors and norms in a lot of these communities as well.
Yeah, such a perfect example of exactly these kind of, I think, things we're linking together of why it's so important to look at these and then understand context of why this might be occurring.
So then once you've collected and published these results, what are kind of the actionable findings from here? And then what else do you think needs to be researched to be able to turn these kind of broad Florida findings into something that someone can take action on from a policy level or a community violence prevention level?
Yeah. Let me start with, I think, the question I get most, which I would love to answer. And this is the tricky part of quantitative data to me, which is, well, why did these things happen? Why are some groups showing bigger or less decreases in these behaviors? And because of the nature of the survey and the questions they asked, I can't necessarily say why these things are happening just from the data themselves. We definitely talk about, and I think one of them is something you brought up before, how with school carrying, I think it's really interesting where if we can find data sets or if people can do qualitative work to better understand what contributed to both because we did look at some favorable attitudes towards school carrying too, what changed people thinking that the norm should no longer be that you carry in schools, and then the actual reported carrying in schools. What contributes to that? Was it those firearm laws that were put in place? Was it that there was school security or metal detectors in place? Was it that school culture programs, positive school culture programs got put into place during that time? Those are all really great questions to be able to link up. And frankly, Florida could be a prime spot for that because we now see these longitudinal data where you can look at some of these indicators, or it's also qualitative work that could happen. But I think that's a really important next step in terms of figuring out why that occurred. And the reason I think answering that why question occurred is because it can help inform these other pieces. We also talked about how, well, general handgun carry so outside of schools went up during that time. Well, if something worked to prevent it within a school system, could some of those be applicable to broader carrying and trying to understand what might prevent that in a risky situation, right? So I think that's why asking that next question is so important. But I don't think that research is the only next step. I think this says a lot about practice and education. In my head, I think what comes across to me here, especially, is that there's an interesting thing happening, especially with females and younger middle school students, that requires more attention. And I think trying to understand what is occurring specifically among those subpopulations, both in school carrying and kind of general handgun carrying outside of school, is really compelling. And I think different community organizations working with young people who make these decisions, or parents or caretakers who are interacting with them in that space, can have those conversations around, firearms increase or it's a lethal tool, right? How do we talk about being really safe if you are choosing to carry a gun? Or how do we talk about not accessing that gun in the first place if there is in a high risk situation, whether it's suicide or interpersonal violence, right? If you're starting to threaten outside that box. But I think this calls attention to Florida young females, especially being a group, or sorry, younger kids and females being groups where traditionally I think we've done a little bit less work, but we need to be talking with those groups as well.
That's important for, lots of school systems that have either physical security, school policing, a behavioral threat assessment team, a violence prevention program. A lot of those are only focused on high schools and maybe high schools and middle schools. But there are many shootings and there are many um, incidents with students arrested with guns on campus that are elementary school and middle school students. And there are also many of those shootings that involve female students. So a blind spot is if you don't have the data, you make assumptions that certain groups aren't involved. And I've heard it repeated many times that, oh, well, women or girls don't commit school shootings or mass shootings. Well, actually, they do. Women also commit shootings during disputes and during domestic incidents. So we can't just discount a group and say we're not going to pay attention to violence prevention for female students just because of a false assumption that they don't carry guns. The same with middle school or elementary school students thinking that they don't have intentionality in carrying guns. I've looked at many different cases where there were elementary school students who repeatedly carried guns, and when they did shoot someone, they said that they shot them intentionally and they wanted to hurt them or they wanted to kill them. So yeah, I think that that's a very important thing. what's really too bad as I hear you talking about this is there would be so many opportunities for true natural experiments if we had this similar data in different states that had different cultural norms, different laws, different amounts of education funding, different amounts of investment in physical security or policing, because then we could have really comparative, meaningful findings around when this is different, this is how it changes. But when we have this patchwork system where Florida is the only one collecting this type of information, we're stuck having to do follow-up research when we really could just answer these questions if we had better data to start with.
Exactly. And I think there are a lot of us kind of advocating for enhancing data collection broadly. And I say that this links back to one of the first things I said too, which is that I think people can often be frightened by the fact that we're collecting these data points, or upset about them. But I try to always remember that that's someone's voice, or experience in the data. And so I just think it's such a beautiful way to be able to heighten people's actual experiences in the world. So a big advocate for making sure that we can really try to patch up a lot of the data that we have and really, as you said, answer the questions up front and then be able to put these strategies in place.
And we as a country, we have done such a good job with decreasing motor vehicle fatalities, motor vehicle injuries, especially fatalities and deaths with children. And if you think about a car in the late 90s, lots of them still didn't have airbags, didn't have dynamic headrests, some still had lap seat belts. And then now today, just 25 years or 30 years after that, we have multi-zone airbags, side impact airbags, all kinds of dynamic moving seatbelts, automatic braking, collision sensors. All of that came out of highway data and knowing exactly what was going into or reducing highway deaths. So it's really simple to look in aggregated information and pick out what works or what doesn't work. And what we're doing is we are letting preventable deaths happen if we don't collect and analyze the best data possible on any type of lethal hazard, whether it's a car or a pill bottle or a dangerous piece of lawn equipment or a firearm. And we are just not doing that with firearms.
Yeah, collecting data is really honoring people's voices in life, 100%.
What do you think, if you could do a follow-up study and you had kind of any resources available, what would that be? And how would you like other researchers to collaborate and build on that?
Yeah, I think it goes back to the why to me of why did these trends change over time. I think I would love to try to understand some of those school-based pieces, right? Of were there positive school climate interventions put in place, or were there more school security present? Again, whether officers or metal detectors, asking those questions and trying to understand the potential influence on these. Because again, I think there'd be so many lessons learned, media attention to school shootings, right? Any of those things were, or laws. We kind of talked about all those potential variables. So I would say that a lot of researchers could probably join, in that piece. I think you could even expand that field, and I think many are, to try to understand those influences on other types of firearm related, harm outcomes we look at. So suicide, just interpersonal violence, not necessarily a mass or a school shooting. I think those are all questions that people are asking. But again, part of this is that sometimes we have to be the ones to develop the data instrument to be able to ask the questions because there aren't these national surveillance systems in place. So the other piece I would say is that I think the more national level attention we can have to combining or collaborating on data infrastructure systems, the better off we are.
And then my last question for you is, it's the middle of the summer now, but the 25-26 school year is going to be here before we know it. This summer, some parents, school officials are going to be having school board meetings or back to school kind of policy meetings where there's an opportunity for parents to provide input on the practices and policies in the school. Based on your research, not just in this paper, but more broadly, what do you think are the most important things for parents to be asking for to either reduce gun violence or reduce gun carrying in their schools?
For parents and caretakers, I would say, and honestly, I am a mother myself, and so I think about my kiddo's too young to be navigating the school system quite yet. Though actually, he is going to preschool, so this is an important lesson for me too. But um, I think we have to be brave and to ask kind of hard questions of our young people directly, frankly, and then of the environments they enter into. I think that's also the broader piece here. So I would say I need to be cognizant of what my kiddo does in the future. And as a parent or caretaker, you can be thinking about this as well. But um, if do you have access to a firearm? Are you suicidal? Are you mad at anyone? You have to ask hard questions because we have to be able to prevent any potential things that are occurring. I want to think that my child will forever be perfect, but he's going to be interacting in this way in the environment around him. So I think having direct and somewhat brave conversations with our young people is an important step as a parent or caretaker as part of this process. And even if you have a firearm in your household and you want your minor to be accessing, you still need to be cognizant of the fact that like they might have hard times or being bullied, and so you might have to reduce access in times where that's more the case. So I think that's like a big thing that we can think about as parents or caretakers in the school system. I think it's the same too of having these conversations where if someone comes to an office or gets called to the counselor's office or the principal's office or something like that, how do we make sure as part of that threat assessment we're also asking about potential access to firearms and if there's a firearm with them or whatever it is. I think those can also be just those informal conversations and part of that assessment process. But I would still say overall, in terms of what we've seen in school-based research, some of this positive school climates work. So more on the positive side, less of this kind of school security piece. I still think that needs a lot of attention because I know there have been adverse impacts for a lot of youth with school security too. I still think some of that is around making sure that young people feel supported and like per my anthropological comment from the start, that they're in an environment that helps them make good decisions. So I think a lot of that positive school climate work is still something I would invest a lot of time and exploration around to really make sure a young person feels supported in the school system as well.
Oh, those are great points. And I hope that they are things that parents listening to this show can take forward and act on. So I want to thank you so much for your time today. Dr. Erin Wright Kelly is the Director of Research and Evaluation at the Firearms Injury Prevention Initiative at the Colorado School of Public Health and a Doctor of Public Health. I have a link in the show notes to the paper on the patterns in adolescent gun carrying in Florida schools. That was published in Pediatrics. I will have a link to that as well. Well, thank you and have a safe rest of your summer. And I'll look forward to seeing your next paper when it comes out.
Thank you so much.